Good evening and welcome to Midwifery Hour for this week. As you can see, I am not Sue McDonald. She's been unable to attend tonight. So just want to say rest up, Sue, and we'll see you back soon. Have a good break from us tonight. But yeah, I'm Dr. Jenny Hall, as many of you will know, I hope, and I'm here just to introduce to you what is happening for this evening. First of all, just want to say it was a wonderful day yesterday for those of us who were able to get to Manchester for the Northern Festival. We had a great time together. It was great to see the number of people who were there, students and lecturers who were able to come, and clinical midwives, some who I've never met before. And it was great to have a chat to you on the MATFLIX stand and to hear the talks. And in fact, they were really brilliant talks. And we've had difficulty tonight actually to choose which are the best ones to share with you tonight. If you did miss them, there will be a box set actually probably by the end of the week, and you will be able to follow it online after that. But it was a wonderful time, and I do hope you'll be able to come and join us face to face at the next one, which I'll tell you about in a minute. So tonight we will be having, as I say, a couple of talks from the festival, which I will introduce to you a bit later, but also to remind you that next week, for an afternoon next Tuesday, which is the 29th, it will be the Student Experience Festival. And if you haven't yet signed up for it, then please do. It will be great to have you along to find out how the students are feeling, apart from anything else. We have actually, for that festival, Professor Mary Renfrew, who is going to be doing a talk. We also have Jess Reed, who is Deputy Chief Midwifery Officer, who will be talking, and also Caroline Flint. And for those of you who are as old as me, you will know Caroline very well. And she's absolutely great. So it'll be great to hear what she has to say. We also have the Nursing Midwifery Council, who are going to talk about Now You Are a Midwife, what next, which is also important to those who are just qualifying or who have just recently qualified, and also to those who are mentors who are actually out in practice, because it actually is worth hearing what the NMC are suggesting to provide that kind of support for future midwifery. Most important, we're going to have a group of students who are going to be doing panel discussions. And we'd also like to hear from any other students. If you want to make your voice heard, we would love to hear from you. Any of you still want to contribute, you still can do. And we would love to hear from you if you want to make your voice heard of some of your experiences that you're having. We're also having a couple of awards actually for next week, and we would like to hear from you again as well for two categories that we have. One is student midwife category, and the other one is for the midwifery lecturers category. And who are the people that you feel have gone above and beyond for everything that's been going on recently over this past year? Who are those that have been supporting each other, the peer supporters who have provided help, personal tutors, people who you feel that should be recognised for the work that they have been doing? It's very easy to tell us about it. You can either email us. Karen Stewart's email is on the website as well, or there is a form that you can actually fill in, which can tell us the person that you want to nominate. Or you can actually also send us a nice little video or a TikTok if you want to do something like that, just to tell us about this particular person and why you want to celebrate them. So it would be great to have this opportunity to point out some of the unsung heroes that we have out there at the moment. So do get in touch with us, and preferably by the end of the week. We would like that so that we can get it all sorted out for next week. But don't feel that it has to be then. Monday will do. So please get in touch with us when you can. So that's the student festival. We also have another festival starting again in September. We have a bit of a break now from our face-to-face ones. And in September, we have the Wales and the South West festival. Now, for all my colleagues who are in the Southwest, we do need to have your contributions as well. We have a few come in from Wales. So for those in the Southwest, if you would like to get your abstracts in to us by the end of the week, that would be great. So please go on the website and send us some in. We would love to hear from you too, because the deadline is actually the 24th, which is Friday. So please pass that on to any of your colleagues to say, come and talk to us about, could be anything, you know. We like all sorts of things, not just research. We like clinical things that you can talk to students about, anything. So please get it in. Thank you for that. Where have we got to? And one final thing is I'm going to talk to you about MATFLIX. And for those of you who are new to Midwifery Hour, MATFLIX is something that I've been working on for about 3 years nearly. And this wonderful company has been filming these festivals for many years now, 5, 7 or 8 years now, I think. And there's about 1,000 of these wonderful talks actually out there. And MATFLIX is something that I've done to put it together into educational packages. So, for example, you could have a topic on antenatal education. There are 5 videos. There's reflective questions that are in line with the NMC and references. But the great thing about this at the moment is that we also have the opportunity for use with Open Athens and the UK Federation. So it means that university libraries can purchase it, and also trusts, and so it can be used for practice development, and it can be used for teaching opportunities such as flipping the classroom, etc. And it's available to all your students, whether it's midwifery or nursing or paramedics or sociologists or psychologists. There's all sorts of people who might find these videos and these talks useful. So I'm very pleased that some universities and trusts are signing up for this at the moment. So if your particular place has not done so yet, then do get on to them and have a chat to them about it and tell them about it. And we can tell them all about how they can connect in so that everybody can have the opportunity to use them. So without further ado, that's enough of me at the moment. We've got 2 wonderful talks that we're going to be having for the rest of the evening. The first one is Pete Wallroth, who is the Chief Executive and the founder for Mummy's Star. And he is talking about cancer and pregnancy awareness and seeing the symptoms, a very important thing that we need to know about as midwives to make sure that we are able to pick it up and to make sure that people actually get the support that they need during pregnancy around cancer. And the other talk that we have is from the very wonderful Wanda, actually her real name is Wanda Warrington, who's the Safeguarding Families Specialist Practitioner for Pennine Care NHS Foundation Trust. And she flew over yesterday from Poland, where she has been volunteering, has got an extended time to volunteer there because she's a Polish speaker, to support refugees who are fleeing from the Ukraine conflict. And she talked about supporting women and families fleeing at time of crisis. It's a very emotional talk, and just be prepared for that as well. But I just want to say to you too that I'm afraid that there won't be opportunity to have any discussions tonight as we usually do. But if you want to email or message us any questions for these particular speakers, then do so, and I'm sure that we can pass them on to them after the event. So do sit back, enjoy listening to these particular talks, and we look forward to seeing you again next week.
What we're going to go through today, a lot of the work that we do at Mummy's Star, it's very much the onus is on sort of the focus being on mum and maintaining a normal pregnancy as much as possible in spite of a cancer diagnosis, which often will totally upend the experience for those families, but also for you as health professionals supporting that family, it can be a really scary time, unnerving. You can question your own professional instinct as to how you can best support that family as that cancer diagnosis unfolds. And a lot of the role that we try and do at Mummy Star is to try and instill that confidence within you to be able to continue a normal care, with those families as much as possible, irrespective of the cancer diagnosis that's been going on in the background. But what we've started to move towards over the last few years is that wider recognition that traditionally, when we're talking about cancer symptoms being seen by people, if people start to get concerned about something that doesn't function or feel right, that their instinct is to always, I must see the GP, or I need to go and get triage or an emergency admission to hospital. But what we want to try and get to a position of is where they can start to disclose those symptoms if anything feels unusual to them, but equally to you as a health professional when you're examining somebody, when somebody's having, let's say, a 20-week check-in, or you have that book-in with that family. If they start to disclose something that they're not comfortable with, that you as health professionals, whether it's as a midwife, as a health visitor, as a nurse, have the confidence to know where your referral channel is and how, and understanding better how you play a key role potentially in the opening up of a cancer pathway to diagnosis. Obviously, we hope it never gets to that stage where families are presenting with symptoms. We hope it's something more innocuous than a cancer diagnosis. The sad truth is, with the cases that we see at Mummy Star, which is about 2 women a day being diagnosed with cancer in and around pregnancy of any type of cancer, when we're only likely to see an increase in that figure over the next sort of 10 to 15 years as families start to leave it later into the 30s to start a family, they're inevitably just going to bump into some of the higher age risk categories within cancer, so you're going to see a slightly higher prevalence. That all said, it doesn't mean that when you do see these cases, you will always be as well prepared as you'd hope to. It is a scary time. It can be quite a traumatic time for you as a health professional, whether you're a newly qualified midwife 2 years into practice, or whether you've been in practice 40 years. We've seen the experiences shared with us over the years of many midwives and maternity professionals, and it is really, really hard sometimes to watch these families and be with these families going through these experiences, because it does make you question, what is and is not possible, what is normal, and ultimately, can that family have, the maternity experience that they had hoped and aspired for? But the best way I can frame this is most recently, last week, we held our Cancer and Pregnancy Awareness Week. It's something that we do every year in June, around the charity's birthday. And the onus this year was around seeing the symptoms. So it almost sounds odd when our focus as an organisation is on, mother, maternity and birth. But we actually almost need to, health professionals, when we're talking about symptoms, we almost need to ignore the pregnancy. It sounds weird, but I'll explain. When families are being, starting to go through pregnancy, whether it's a first-time pregnancy for a family and they're starting to get used to what does and doesn't feel normal, what is part of the pregnancy, what are the body changes to expect, and versus what should and shouldn't be alarming. When somebody does present often, there's been a culture of dismissal of symptoms, or because symptoms are very, very well hidden during pregnancy. So certainly for any of the atypical breast, abdominal discomfort, gynecological cancer red flags, many of those can be just as easily explained away by the fact that somebody is pregnant. They would be experiencing breast changes anyway. There'd be a lot of change in and around the abdomen, but also gynecological symptoms such as bleeding, early pregnancy spotting. There can be many other reasons for those things to happen other than cancer. What we want to try and get to a stage is where it's always given consideration. Yes, thankfully, it will be the rare time that it's actually just diagnosed. But if we can get into a mindset of always considering, what could this be an early sign of? Has this woman presented before? Are we listening to her? Can I, as a health professional, actually refer her to the breast clinic or the gynecological clinic or gastro clinic, so that we can make sure that these symptoms are looked at, investigated properly, and then at least that family have an answer as to what's going to happen next. If the worst comes to the worst and it is a cancer diagnosis, obviously the earlier that detection takes place, then the wider the options are for those families in terms of sort of what the outcome for that cancer can be. So we talk about this in terms of our campaign last week was called See Me, and it was about the first part of that was about seeing the symptom. Like I've said, we need to see cancer symptoms in independence of the pregnant body. Yeah, and if we look at, say we had 2 women sitting in front of us, both of whom are complaining of a discomfort in the breast, and it's been there for several weeks, and you have 2 women, one of whom is 20 weeks pregnant and the other woman isn't. The chances sadly are at the moment that the woman who is not pregnant will probably receive a breast clinic referral very, very quickly. Whereas because the other person is framed in pregnancy, it becomes almost the dismissal or the excuse to be able to say, well, it's probably pregnancy related. You should be expecting various body changes, breast tissue changes, size, etc. Feel and touch. And it's about moving towards the seeing the symptom, you know, outside of the pregnancy, and how would you respond if that woman was not pregnant in your care already? And that starts that pathway then to say, right, if we're starting to look at it in independence, we start to see that woman in independence as well, and listening to her concerns and listening to what her normal feels like. And also for you as a professional, if somebody discloses something, are you alarmed, or are you physically examining somebody, for example, and something doesn't feel normal to you? None of you are oncologists. We're not oncologists. We're not midwives when we start either. But we get to work with you, you know, with a huge cohort of maternity professionals. And we know that you have that time with families where they will build up that bond of trust with you. And when they're seeing you, whether it's a continuity of care model that you're operating under, or, you know, or otherwise, some of those families are likely to disclose something to you more so than they might do in another health setting where they might have had a negative experience previously, or there's a, you know, they build up that bond of trust with you to say, look, I saw you 2 weeks ago, you know, this symptom was starting to concern me, but it's not gone away, and I've tried, you know, various things. It was like, right, well, what can we do next? What can you do next as the midwife? What does your instinct tell you? If in doubt, make that referral. But I think where we have worked with people over the years, there isn't necessarily that wider knowledge that a midwife can be a referral point. The question we ask is, why does everybody not know that? And I think it's largely because there's the inconsistencies that exist in different hospital settings as to how easy it is to be able to do that, and perhaps what practices have shaped the freedom that we have to refer. But the reality is, whether you're a midwife, whether you're a health visitor, whether you're a nurse, whether you're the obstetrician, anybody that comes into contact, any health professional that comes into contact with a pregnant family at any stage during that pregnancy should be seen as and consider themselves a potential point of referral. And ultimately, you start to become, I suppose, the creator, if you like, of that cancer pathway. Because if you have a family sitting in front of you, why push them back out into the community setting? Why push them back into a GP if you're already in a position to make a simple referral and get them that referral? GPs, as we know, are quite overloaded already, and I think they come in for a hard time with regards to cases like this, where people are presenting with symptoms and they feel like they're not listened to. But a lot of the time, GPs are referring people through, and they get met with an age threshold where, despite the number of red flag symptoms that a family are presenting with, the referrals are knocked back because those families are too young. And it's a phrase that we sadly hear way too often in cancer circles is, well, she was too young. Why would she be considered for that type of cancer? The point is, if the red flags are there, the age shouldn't matter. And if you're already in a midwifery setting, you can hopefully be able to push those referrals through straight into the clinics within those hospitals that you're already at, and circumvent some of that potential delayed time. So symptom masking, like I touched upon, it can happen in many different cases, whether it's, we try and encourage families, any discharge that they felt during pregnancy, get it checked. Any abdominal discomfort that doesn't feel right, again, get it checked, you go back to your midwife, tell them again that it's, that symptom has not alleviated since you last saw them. But likewise, even if you are seeing somebody, if that person is not disclosing something to you, but you can physically see a change in somebody's body that does not look normal, obviously make the family aware, but make them aware as to why you feel that referral needs to be made. Yes, we will, whenever we mention, I suppose, the word referral to a specialist clinic, we're always going to create some anxiety and worry in a family, but it's surely better to create short-term worry, to seek a solution or seek reassurance long-term, than it is to just leave it and then potentially something gets caught at a much later stage where the options are far less wide than they hopefully could be at an earlier stage. So likewise, the more we can do this, it obviously lends itself well to an earlier detection ultimately of that cancer. Like I said, if indeed, thankfully, most of the time we would get somebody referred through, it would just be diagnosed, for example, as something like a benign cyst in the breast, or somebody just having, say, lumpy breast tissue, and it just it becomes even more profound during pregnancy. But again, for those families where we do manage to get something investigated, and there is that earlier detection of a concerning symptom, the quicker that clinical referral is made, the more those diagnostic tests can then be done at an earlier stage. With pregnancy, we know that diagnostic challenges do exist because of the various stages people get diagnosed at, or certain scans that are not able to be done once somebody is further into, say, the second or third trimester than they would be in the first. But equally, it's about making sure that those families at least have the opportunity to be able to see somebody, to be able to have those checks done. And if it does ultimately get to a detection of a cancer or a concerning sign, that at least there is the start of the follow-up and the the regular checks and monitoring as the pregnancy continues, so that you can keep an eye on anything that becomes even more concerning or that needs immediate intervention before we get to a potential point of diagnosis. Explore the symptoms. This might seem obvious when we're talking about earlier detection, but what we mean by this is the Embrace report has now for several years has reiterated that we need to, when people are presenting with symptoms of concern, whether it is cancer related, whether it's to do with another serious health condition, the point is that it's not good enough anymore to diagnose what it isn't in a person when they're presenting. So if you send one of these women, say for example, to through to a breast clinic, and they're told, as that previous example, that it's a benign cyst, but that pain continues and those symptoms continue that are concerning her. Well, just because she hasn't been given a diagnosis of cancer, is there something else that's going on? Because it's still concerning her, it's still causing anxiety. And at the end of the day, we don't want somebody to be going through their pregnancy in a heightened anxious state. We want them to be able to be in a more relaxed, calmer state and knowing that there is investigation going on. So we need to seek a diagnosis of what something is all the time. If the first check doesn't show up something, then it needs to be followed up again and again until you get to a point where you can say the cause of this symptom is X, rather than just constantly saying, don't worry, it's not that. That does not alleviate the concern in the person if the pain doesn't go away. Likewise, people, they get concerned about representing, especially I think in a post-COVID era when there's still very much a culture in it that exists of people being concerned about putting pressure on GPs and putting pressure on services. It's reiterating that message that the NHS is open, and if you are having concerning symptoms throughout at any stage of a pregnancy, just as equally postnatally as well, is that you do go and get checked, whether it's a virtual appointment, whether it's an in-person appointment, is at least make the appointment in the first place. Be your own advocate, as well as for the role that health professionals can play in actually getting to a point where we start to explore. The more we explore those symptoms, the more we can rule out hopefully the less serious issues. But ultimately, it just goes to alleviate concern of those families as they're going through that pregnancy, and we start to draw back onto an enjoyment and the fulfillment of that pregnancy. If we do sadly get to a stage where a cancer is diagnosed with a family, if we've done all that, then you as a midwifery professional are able to proceed with the care of that family, knowing that the cancer has been picked up and has been diagnosed and there is a treatment plan for that. But the role for you then is to proceed as normal. You're not an oncologist. Your role is not to treat cancer. Our role collectively is that of supporting that family through that pregnancy and trying to maintain as much as we possibly can a normal pregnancy, an enjoyable pregnancy, and one that is based on informed choice and personalized care. So I've touched upon this in various different points, but your role within this is huge. Not to put any pressure on it, because it's more about almost instilling a confidence in you that when you do get faced with cases like this, they are, like I touched upon at the beginning, they are really traumatic. You won't see cases like this regularly, even if you attended one of our study sessions at university 3 years ago, and then you suddenly are confronted with a family that you saw at 12 weeks and everything was absolutely fine and they were really excited and looking forward to everything. And the next time you receive those notes and you realize there's been an oncology intervention since, and that family is sitting in front of you, it's knowing the role that you potentially have played in that and been able to reflect and said, I'm glad I made that referral. I know it's obviously come to a traumatic point for that family where they're having to contend with a diagnosis of cancer, but you know that you picked up on that symptom and that you have had a key role to play in starting that pathway to diagnosis. It could be that thanks to you, because of that timely intervention, that family have actually had way more options from a cancer treatment perspective than they otherwise would have if that diagnosis had come because of an acute admission to A&E, for example, and by that stage that cancer had sadly already advanced to another part of the body. But we're not talking about being able to be, the cure here of that diagnosis if it does happen. It's just about being able to understand that the role is. I've heard it several times over the years where we talk to students and student midwives, and we hear the phrase, "But I'm just a midwife. How can I play a role in that?" But it's actually the total opposite, because you are way more than a midwife. You are far more than the maternity professional title that you have. And it's so all-encompassing in terms of being that family's advocate, being their voice, pushing for their choices in that pregnancy. And in spite of that cancer diagnosis that they may have then subsequently had, it's about making sure that, well, why can't that family have a home birth just because they've got a cancer diagnosis? Does that somehow create more adverse risk than otherwise you would have with any home birth? But we don't stop offering them just because. Likewise, if somebody wanted to have a water birth, for example, and they've had a brain tumor diagnosed, does that mean that they can't spend any time in the water just because they've had a brain tumor in the same way that we would have with a patient with epilepsy? Does it mean that we can mix and match the delivery mode a little bit, where they can have some time in the water and then they're able to come out after a certain a certain point of dilation where they then deliver, outside of the pool. But it's about trying to almost within this setting create a patchwork almost model of maternity care where we take everything we can to try and maintain that family's ultimate desire for that pregnancy and try and create as memorable a pregnancy as possible in spite of the fact that they've had this deeply traumatic diagnosis of cancer. Because it might sound like a really, really odd way of phrasing it, but in spite of the fact that these diagnoses do happen to families, if you're able to offer that really informed model of care, really compassionate, personalized care model for families and treat, look at each one of their individual circumstances around that cancer diagnosis, you can have families where ultimately the cancer outcome is not necessarily a positive one, but they will reflect back on a really, really positive, really well-supported pregnancy journey, and one that ultimately where the focus became about pregnancy again, where at one point it was actually in danger of being pulled away from them because a cancer diagnosis had come and it was threatening to actually overtake the entire maternity experience. We see it on a regular basis and we see it achieved on a regular basis, whether like I said, irrespective of the cancer outcome, whether that family are in a curative situation or whether sadly that cancer spreads to another part of the body. It's about making sure that the focus is on them as a pregnant family or as a family that are growing their family and being able to support their choices and support both her in terms of the delivery, but also them as a family and their needs, both in terms of the support of each other and also as to how the different levels of sort of trauma that will come into that family's experience and how they could play in it, whether it's an in-pregnancy diagnosis or whether equally postnatally, where we see all the same issues that I've outlined here in terms of symptoms that are excused away by pregnancy, postnatal bleeds, for example. Women are told that they will bleed postnatally. How long is normal? How long before it gets investigated? How long before something serious starts to get uncovered? All the symptoms that are in pregnancy can be just as well hidden postnatally. So it's just as important from a midwifery setting as it is that we move this message into health, health visitors and anybody else that we could be seeing those families on a regular basis postnatally as well. So just to reiterate the message behind that, it is the see me, it was very much, it's see the symptom, explore thoroughly, lead to earlier detection, and ultimately we're looking at far wider options for families from a cancer outcome perspective. If we can get to that point and we can make sure that everybody who comes into contact, it could be anybody in a maternity sphere comes into contact with a family, that they know that they are a potential point for them to refer or for them to see those potential red flags that those families are presenting with and make the referral through, because we just don't want to be left in any doubt that we could have intervened potentially, and trying to see it from our, I suppose, outside our traditional role that we've worked through for years. Because like I said, this is something that is probably only sadly likely to increase in terms of the instances that we see. Like I said, it's about 2 women a day at the moment. But because of those changing birth trends, it's likely that we're going to see an increase. That's not to say there's causation between cancer and pregnancy. It's just, like I said, it's just the different lifestyle choices, changing birthing patterns, etc., are going to likely see an increase. The main thing, if you do ever come across a family like this and you find yourself actually supporting a family who've already been diagnosed, please do reach out to us as a support mechanism. We're not just there for families, we are there as much for you as we are for anybody else. It can be a point where we get contact from midwives and maternity professionals regularly saying, I've got a family that we're in touch with, I don't really know what to do to help them. And it's just as simple as a phone conversation to say, just talk us through what you're doing already. Most of the time we'll just agree and say, wouldn't suggest you're doing everything that you would do for anybody else. But it's just that, what I think I said earlier on about, it's that point where you potentially start to question your own professional instinct on how to support a family. We'll always revert back to just support them as you would any other family that comes into your care, because at the end of the day, that's how they want to be seen. They don't want to be seen as cancer patient who happens to be pregnant. They want it the total other way around, which is I'm a pregnant person who happens to also have cancer. And that's where that maintains the focus on the fact that that growing family and that maternity experience can then be protected as much as we reasonably can, and ultimately leads to a more positive, birth outcome for those families. Likewise, with all this, obviously, we do frame this in birth and postnatally as well. But there are many of our families, sadly, where they will experience a loss during that pregnancy, either because of the nature of the cancer diagnosis and how aggressive it is, may lead to the need clinically to intervene and actually end that pregnancy earlier. Just as much in those cases as with anybody else, it's about normal care in the sense that offer those families all the bereavement care that they would normally receive. Because what we sadly do see at times is when there's been a cancer diagnosis in pregnancy and then there's ultimately been a loss that's resulted immediately afterwards, that family status immediately becomes a cancer patient only, and the bereavement is totally lost. And we see families who don't necessarily receive that follow-up sometimes, depending on the type of cancer they've been diagnosed with. But when we talk about normal care, it's in pregnancy, it's postnatally, it's in bereavement, it's the entire sort of range of experiences that families can happen to make sure that they're treated and focused on. Because in that example, like I've just said previously, they are a grieving family first and a cancer patient second, and they don't want to be started to see as the other way around, because that's when the loss and the compassion and care starts to get shifted away from them. So if there's any questions, we're on the stall, obviously myself and my colleague Tracy today. If there's any questions that anybody has about anything that we do, you want to know a little bit more about our work, you want to know about the education and awareness sessions that we offer, hospital settings and student midwives and any student health professional as well, please do get in touch and we'll sort of have a conversation. We'll tailor it to your particular setting and the actual time allowance that you guys have as well. So thank you very much.
So I'm going to talk to you today about my experiences of volunteering on the Poland-Ukraine border. Just so you know a little bit about me, I have been a midwife for a long time, 27 years. I worked as a community midwife and a specialist midwife at Bolton Foundation Trust. I've moved over to safeguarding, but I've also maintained my nursing qualification. So I've been working out there, doing some nursing and midwifery. But what I've decided to do today, in terms of the presentation, is that I feel that the photos speak more than actually seeing words. So there will be some images on here that might move some of you. So I'm not doing it for shock value. This is the reality. So why did I do this? I went out for the first time in March for 3 weeks. I decided to take unpaid leave from work. Why did I feel compelled to do this so strongly? It actually goes back to my family background. My grandfather, his mother, my great-grandmother and my aunt, his sister who was 8, were taken to Auschwitz during the Second World War. My aunt was 8 years old, she perished, and so did my great-grandmother. My grandfather actually survived. If he hadn't, I wouldn't actually be here to speak to you today. So I've got grandchildren, and I spend a lot of time with my grandchildren, usually when I'm not doing this, which is completely alien to me. This is a whole new phenomena. Never expected that I would be doing anything like this. But what I felt when I saw those queues of people that were standing there in the freezing cold was how it would have been back in that time of the Second World War for my family. And if that happened to my grandchildren, now my granddaughter is 8, I would want somebody there to try and help. That was the only thing that was in my mind. And I just said, I'm in a very fortunate position is that because my family's Polish, that I actually speak Polish, and that helped me a lot. We'd been collecting funds. We'd been collecting at the Polish Social Centre in Bury that I'm linked with, and we were sending a lot of aid over, but I just didn't feel that was quite enough. So I thought, well, I'm going to go over there. So what I did was I contacted the actual administration of Przemyśl. I'm sure you've heard of Przemyśl, where the big humanitarian centre Tesco is at, and they welcomed me. And with that, I flew over, and there I am. My husband's friend kindly embroidered the nurse on the back of my jacket there. I actually wanted midwife, but I thought nurse midwife, it's all too much. We'll just keep it a little bit generic. So there you go. So I set off, and I was based outside the humanitarian centre in it was like a converted sort of like bus really, and they're people that I will call them displaced people. If I had to use the term refugees, it doesn't quite seem to fit for me about refugees, because they are displaced. They're not there through their own choice. They're fleeing because there's an actual war going on. So I felt it was really important for me to just ask a few questions and just to speak to them. And I think the images that we see on the television of people when they were queuing to come into Poland, actually, it was all those women and children. And I just thought, what about the unborn? That's what stuck in my mind, is like what is going on. You've got people who are travelling 30 hours on a train, crowded. There could be 4 generations. You've got mothers, grandmothers, you've got children. By the time they get off at the other end, they've not given it another thought. They've not even thought about the maternity records. They've not thought about anything like that. So I didn't go out there to, hey, you know, I'm practicing here as a midwife. It was literally just to give that bit of support and just that reassurance. So that's our passes that we were given. The image that you see there is a logo that somebody had actually bought me that picture and said that kind of depicts the work that you're doing. So that's quite a nice image. So there's the Tesco Humanitarian Centre. As I said, I was initially based outside. There was a lot of people coming and going. There's been issues, I'm sure that you've all seen in the news. Things have died down a little bit, I would say now. They're not talking about it. This is very real. It's ongoing. So you've got human trafficking. You've got grooming, as well as everything else. You've got inappropriate relationships with, in some cases, with volunteers and refugees. There's also been allegations, I will say, at this point, that have been investigated in terms of organ harvesting. And as I say, the people, although the army's there, although the police were there, although there's officials there, there is a high rate of corruption and fraud that are going on. In terms of when there's a war going on, what you will see is that it brings out the very best in people, but it also brings out the very worst. I've seen every bit from each angle. So World Central Kitchen are there, who are helping and providing food. When people come, they will register at the centre, so they come in buses. A lot of them have been travelling for a great length of time. They come up with the clothes they stood up in. They've not given it a second thought to pick up the maternity records. They've not given it a thought to bring any of the medications. They've literally left in what they've got. And so when they register, when I first arrived, one of my questions was, you know, do you actually ask if anyone's pregnant? Oh, we don't have any pregnant women. And I went, oh, right, so we're surrounded by all these women and children, but we don't have any pregnant women. I went, I've just sort of seen half a dozen in the last 2 minutes that have passed me by. So what I did was I started to circulate and speak to the volunteers and just started to chat to people. And as I say, I wasn't there to do anything anymore than to give that reassurance. So I would, you know, I'd just do like a routine antenatal. One of the things that you'll see as the presentation goes on is that when they've not thought about the unborn, when they actually listen to that fetal heart, it makes them, the stress just melts away, the shoulders drop. You know, I had tears, I had hugs. I had people who have had extreme trauma, who have been like living in, you know, bunkers, have been underground, just listening to that constant shelling. And then when they come to the centre and they're greeted and they start to think about what's gone on, then you can actually see it written on the faces, you know, how much trauma that they've gone through. So you can see in that picture there, which is some of the, as they're coming off the buses, you can also see there some of where they're sleeping. They're sleeping in a converted centre where you've got a lot of just camp beds and people are just all put in there together. And that, again, for me, is a lot of safeguarding concerns in relation just to that. But they've not slept for many hours, so for some, literally when the head hits that pillow, they sleep for hours and hours. I've talked to you about sort of the Tesco at Przemyśl, the Humanitarian Centre. There was another one at the other border, which is called Korczowa. That actually closed down on the 1st of June. This image here is of Medica. Medica is literally right on the Polish-Ukrainian border where they cross over. The middle picture is when I first went over, it was lined as people came off with World Central Kitchen, with NGOs from, there's the Red Cross, UNICEF, World Health Organization, they were all there. And they were just there giving out bottles of water, giving out fruit. There was people that have come from all over the world. There was a woman that I met, Christy, and she was there from the beginning, and she was just giving out like maternity products. There was a baby changing area. The simple things like that, just somewhere to change your baby. When the situation was when it was very, very cold out there, they actually had a baby that froze to death while they were in the queues, and that's just absolutely shocking. So it was a place where it was very, very busy. There was lots of help and support. Now, as you can see on the pictures on either side, I took these on Saturday, I think I was there. The NGOs are all leaving. The reason being now is that the administration, I think, are feeling that things are running the course. They aren't running the course at all. People are still crossing over. However, they wanted to have contracts and start charging rent. So the big organisations who are like charity organisations basically said, we're leaving. So the need now is more than ever because we haven't got those big organisations. So we've gone from having all of this support to very little being there right now. And that's one of the places when I go back, we're looking to get set up another medical point. I got a telephone call only the other day, and it was 14 people, 7 adults and 7 children. And the children were just running around there. There's a lot of people just sitting, observing. There's cars coming and going. And it's quite concerning about the situation of what is at, of what they're looking at and what is going on there. So I wanted you to just have a quick look at that image because it very much depicts the war is ongoing. It is still happening. So these are some of the pregnant ladies that I've seen. So Vita at the top there with Sasha. She's a 16-year-old. Both the parents died, and she was. Her auntie had a care of her. They came from Luhansk, which was down in the east, over 1,000 kilometres from where we were up in the west. And they were living in a school where we were going in doing sort of like primary care with an organisation that I was working with, a charity organisation. And when I met her, again, I was asking about her medical records, asking her about had she seen anybody up in the West, had she been linked up with anything. So I just did like a routine antenatal, and also I made sure that she had everything that she needed for the baby because she didn't have anything at all. There was her and another woman that were there at that time. And one of the issues that we came across was that I was leaving the following day, so I sent a volunteer to deliver all of the things for her. And the minute my volunteer handed everything over, within 20 minutes, the director of the school had come and removed everything from her. Luckily, I had an interpreter who she could converse with that had been out with me, and she messaged her and told me, so I sent my volunteer right back, who then moved into the school. There is a lot of corruption, there is a lot of fraud that is going on, and that's the thing that I really struggle with, to be fair. So in terms of Vita, I did ask her whether she wanted to cross the border, but her auntie wouldn't cross with her, but because she's under the age of 18, then she's got the responsibility for her. So she couldn't actually choose to go on her own unless her auntie went with her. So she's got no choice. She has to stay there because of her age. So again, we did everything that needed to be done. We linked her up, gave with the local hospital. So what you find over there is that while there is nurses, and they do have midwives as such, but it is obstetric led. You sort of register with a doctor more than anything, and then they go to the. It's very much they always see the doctor. So although they've got the midwives there, it's not really like that midwife led care. But obviously in this situation, a lot of the nurses and the midwives have left. So the males that are left behind because they can't leave the country. So there is a lot of doctors and medical staff, but there is a shortage of nurses and midwives. So the other image there, this lady was at the humanitarian centre. She came to see me. Again, she had 3 children, and she's type 1 diabetic. And so once we'd done all the routine checks, her diabetes was really uncontrolled. So we had no option, we had to send her into hospital because she was in Poland on the Polish side. They've got a maternity unit, they've got a hospital, they've got everything that was there. So we sent her in there, and we did the right thing. They ended up stabilising her, and it took 3 days. But if I hadn't been there, I would wonder what would have happened with that woman. The issue was she had 3 children as well, and the three children had to be cared for overnight in the centre. And again, if you think about those safeguarding issues that brings in, that calls into question, the following day, the police had to take the children and they had to go into a children's home while the mum was in hospital, which again, that is really traumatic for those children. But what we did do was try to manage it in terms of the children went to visit the mum so that they could see each other, so that they could speak to one another. And at least that they could have some support, some reassurance. So as well as doing a bit of medical, we're just currently trying to convert another school. We've just got the funding for that from some American investors. And we're going to be converting this school that's a museum at the minute, school museum. And we're going to have 30 refugees in there. So I'm really excited about that. That's in the west of Ukraine. And then I also do have an ambulance because I've got a Polish friend who was volunteering. And then when he went back home, he left me the ambulance. So what we do is that we loan it out to organisations. In fact, actually today we're currently just managing. There is an English soldier who has been wounded. He's been operated on today and needs to be repatriated. So we're looking at that, if we can support that. I am self-funded there. I don't take anything out of the funds that I've got. We fund ourselves there. Everything that we do goes directly to help out the displaced people and families that are there. So that's Dr. Sebastian there, who we're handing over the keys to the ambulance for him to do some repatriation. And this is a lovely story. And this is another Vita. And I met Vita. She was living near where we were staying. And her parents and family are over in the Ukraine. It was her first pregnancy. Her husband was with her because he'd been working in Poland. She'd gone out to join him when the war broke out. So they moved around from different areas in Poland, closer to the border, because the family could at least come over to see them. And so when I met her, she was about, I'd say she's 37 weeks gestation, again, very little care. So that's what I did. I just supported her. And again, linked her up, got her to be seen at the hospital. She went and she had she birthed, and that's little Lubomir there. And when she came home, she'd been in for 2 days. The postnatal care, I would have to say, as we know, it's the Cinderella service. We've had the talk earlier that I went to, the masterclass, very much so in Poland as well. So she'd had no support. She had really struggled to breastfeed. And nipples were really cracked and sore. So I just spent some time just doing the positioning, helped her to bath the baby, you know, just the basic things that we do, and just did that. But Mum went on to successfully breastfeed. When she came home, she was on the verge of giving it all up. And you haven't got the photos, but actually on Sunday before I came out, we were invited to his christening, and I was literally treated like a guest of honour at this Ukrainian christening. It was lovely, but it was such an honour. But that's what it's all about, the smile on that face and the baby. It's just it was the basics that we did. So there's some more images. That was in the centre. And what I did was I didn't base myself in the centre. What happened is I kind of become a community midwife. So I'd be called to go to the humanitarian centre in Korchova. I'd go to the station where people were coming. The Red Cross were based there. They had my number. And I would also go up to Medica and Tesco. So I literally was just sort of going around all the different places. Just when actually the doctors were asking for me to come. We did have a lovely team that came from Paris, 2 obstetricians, and they were with Action Sans Femme was the organisation. And they set up on the car park, and they had ultrasound scanning, they had a CTG monitoring, they could do, so they had everything. So we linked up really nicely. And what I really liked was they said, you start up the work here, we're going to work with you. You've got the experience, and that was really something quite refreshing to hear, I have to say. But again, when they were there, but organisations come and go, so the lack of continuity is an issue. When I came back the next time, they've left. They told me they were going to be there for 6 months, and that for me, it worked really well. We had a really good system going, but again, what we do is that we just regroup and we just see what we can do. So some of the other things that we do, we send aid. So again, I've got we give prams, we give out nappies, vitamins, anything that someone requires. Is that we have a lot of donations. So where I live now, it's a bit like a storage unit, really. So we send those things out. I also travel into the Ukraine. And we go, I was in Kyiv a couple of weeks ago, and I went into Bucha and Irpin. I'll show you some pictures there. But yeah, so we gather all the things and we send those things that are needed, which when you're having a baby, those are the things that really matter if you haven't got any equipment and things like that. So it's quite nice for them to have all of that. So that picture was sent to me because I get a lot of things sent to me. So when we've sent aid, where we sent it to, they send us pictures to say thank you. This is how it's been used. So I'm going to put you a little video on now. I think this kind of, in essence, captures some of the work that we do. So if you just have a quick look at this, are you going to play it?
A hug from a stranger and a blanket. Small comforts matter when you're so cold. 4-year-old Alison fled Kharkiv with his mum and brother Valery. They've been travelling for days and are sick with coughs and fever. Juliana, their mum's heavily pregnant and something isn't right.
She feels very small. I've just examined her, and I would say she's probably around 28 weeks. So we're going to arrange an urgent ultrasound, and she looks anemic, so we're going to try and get that sorted out.
Desperate volunteers at the refuge centre called midwife Wendy. She's rushed here to help. Juliana's in shock. Her husband's in Ukraine. She and the children are living in a storeroom until they know where they're headed. And without Wendy, she and her baby wouldn't be getting the specialist care they need. Wendy's husband Simon's just driven 27 hours from Bury, and straight away he's on this mercy mission in a donated ambulance which will stay in Poland. It's good news for Juliana. She's only 6 months pregnant, so the baby's a healthy size. At last, a glimmer of a smile. The first in a long time.
It's just made my day, honestly. Just seeing the children, the smile on the faces and the relief on mum. This is what it was all about. The memories that I'll have and the photos that I'll have will always stay in my heart and in my mind what I've seen here.
In the 3 weeks she's been here, Wendy's seen and heard enough horror to last a lifetime. Her care's brought reassurance as life starts and comfort as it ends. During a perilous trip across the border to Lviv, she met 23-year-old Ivana, too ill to stay and too ill to travel alone. Forced to say goodbye to her love, both know they'll probably never see each other again.
seen her with a partner, Vladislav, who was ready to go to fight to war, to see their sort of tenderness between them, but they both felt that they had a job to do, and hers was to go to Warsaw in the hope to get well, and him to go fight for his country.
Ivana's since been transferred to a hospice. Wendy hasn't heard from her in 4 days.
It's a bittersweet, because we know with it being a hospice what ultimately the outcome will be. However, to know that she's safe and she's going to be comfortable, I just want her to be on her own.
Yeah. Just help me to hold this picture.
I think the sound of the air raid siren, and when we were transporting Ivana, that did frighten me a bit, but we just carried on.
How did you feel when you heard that?
So, no.
Prepares to leave Poland. Wendy's already planning her return.
I don't think until you've been here and you've actually been inside the humanitarian centres or spoken to the people and listened to their stories, that you can actually quantify the true horror of what is happening. And for me, that's something that will stay with me, I think, for the rest of my days. I never expected in my lifetime that we would see something like this happening again. And this is why, we must help. These people haven't chosen this life. They were living their life. It's been snatched away from them. So giving them some comfort at this time of that extreme trauma. And sometimes that can just be a smile or holding someone's hand. It can be, giving somebody a hug. It can sometimes just be the smallest thing that really makes that bit of difference, and somebody will hold forever.
And who are you most looking forward to seeing when you get back?
I'm looking forward to seeing my grandchildren and my children, of course, but my grandchildren, I've missed them so much, but I know that they are proud of me, and that means a lot. And I hope that when they grow up, that they will be able to maybe, remember like what the grandma and granddad have done, and will shape them into being good people.
She may be leaving, but the loving care she's left behind will stay with those she's helped for as long as they live. Victoria Grimes, ITV News, Przemyśl on the Poland-Ukraine border.
I want you to show that clip because it really just depicts everything that I do. I'll probably get a bit emotional now because Ivana's actually passed away. Sorry about that. I do sound a bit common, don't I, on there? I really need to have some elocution lessons. So yeah, that's Vladislav and Ivana. I didn't tell my family, I promised them when I went to Poland that I would not cross the border. Of course, I didn't adhere to that at all. And I thought, well, I'll tell them once I've been. And then when I got there, you saw it on the clip, I was picking up, I was told I was getting a 4-year-old child to transport. And it was 23-year-old Ivana who has had cancer. I was told we were taking her to Warsaw to a specialist oncology centre. I was a little bit taken aback, because it's not what I was expecting at all. But when I met her and I met Vladislav, and he was literally in all his army gear and he was ready to go, and he's going, I'm going off fighting, on the front line. And when they were saying the goodbyes, and she couldn't speak any English, and my Polish is good, but my Ukrainian's not that great just yet. And but we went down, and so when I went back in April, I went to see her, and she was, by this time I knew that she was terminal. She was in a hospice, and then she passed away on the 24th of April. But when I've been back, I've been to see her mum. I met her mum when she was up there, and her mum now says to me that I'm just like her family. So that was just a few images. So the things that happen and the things that we've done. I'm also in contact with Vladislav. He is alive and well. He's still going. He's just being called back down. He is on the front line, but he's okay. So that's Ivana's mum. That's what we're doing. That's some more other things that we've done. I couldn't even come home safely or quietly. what I had to do was, I was asked whether I could bring this family back. That's Grandma, who's in her 80s, and they'd got the visas, but she was immobile, so could we escort her back, and with her 2 grandchildren. So that was, and the family met her there, her daughter was there, which was really lovely for their reunion. My husband supports me all the way, and I couldn't do it without him. There's some more images there. That picture there that you can see, the first one, that was when I was in Lviv, outside the station, when the medical train had come in. And I have to say that some of the sights and smells that I've seen on there is something that will probably stay with me for the rest of my days. So we also help, that's the Ukrainian ladies handball team. They're over near Stretching right now in a school. And what we've done is, one of them's pregnant. We've sent everything over for them. We've sent clothes. We've provided medical supplies. We've opened up an account in the pharmacy to help to support them. So as well as doing in the Ukraine, we support people as well that are Ukrainians but that are in Poland. The children there, the lady that I told you had diabetes, those are her 3 children there, just before we took them to see her. And then, this is my little bit of, I never expected these. I was, my little bit of publicity things that, didn't do it for publicity, but I was harassed a little bit to sort of do these interviews. The reason why is because to keep it at the forefront of the mind. I've been home now, there's nothing on the news. Please spread the word, this is still going on. You know, please do what you can to support. It's very, very real what's happening out there. I literally was meeting somebody outside the station, and they went, "Oh, Amanda's in there waiting for you." I'm like, "Amanda who? Amanda who?" And then it was like, "Oh, Amanda Holden, hi." It was a bit of I didn't even know. So yeah, but this is now when it was all at the forefront. So that's our little team that were from Humanity First. Those are my lovely French obstetricians there, who were really, as I've said to you, very, very supportive. And that's some of the Polish paramedics who we were working with when I first came. And I'm rushing through this now because I don't think I've got much time left. So these are some of the donation runs that we've done. So we fill up the van and we just drive to where it needs to go or where we get called to go to. And this was when I went to Kyiv 2 weeks ago. So these images of, in Kyiv, I mentioned Irpin and Bucha, totally flattened. The picture of the tank there as we were driving out of town, they were just all their burnt out tanks and everything else. And people were just sort of like going and looking at them. We took a lot of aid there. It was an 8-hour drive down there. It was quite a very long journey because we have to get because we're struggling with fuel over there. But we delivered the aid to, it was a church where the priest distributes. When I got there was a line of about 100 people. What you've got to know is that people have lost their jobs now. They're not working because of that. The infrastructure's gone. They've got family that are going, that are fighting in the war. So they haven't, so people are literally, they are starving. So we go around the surrounding villages. We do grab bags and hand those out as well. If you want to follow, that's I'm looking a bit stern there at the station, but it was quite, it was a bit of an emotional day that day. So it's a closed Facebook page because I do have to say that when you're in the public eye like this, you do face trolls as well when you're trying to go and do a good thing, but never mind. So that's the Wanda Warrington Polish-Ukrainian journey. Please feel free, everything that's on there. I didn't set this up for any other reason, is that I don't have time to write anything down. So this is actually just for me, so that I can look back on this one day and sort of look at what we've achieved. And I just wanted to end this presentation's in memory of Ivana. Sorry, she really struck a chord. And it just sums up all the work that we do. And yeah, thanks for listening today anyway.